are some common things that if they patients fail conservative care, they end up going to you, hey, let's get an X-ray and MRI, get some more pictures, and then you get the diagnostics, and you're like, oh, that's what's causing the problem. What are common things that might be causing the problem? And then also talk about specific to injections. We get a lot of questions about injections. We try to avoid injections, but sometimes the patient needs it just to like get inflammation off a really hot nerve because we can't get anywhere in therapy, or they're just not responding the way that we want them to. Talk about some cases that you've seen in the past that have benefited from what the protocol you're talking about, getting some diagnostics. Okay, we actually see the problem, and then what is the intervention?
Absolutely. So very common things that we see in a pain clinic is pertaining more to like a disc herniation. A patient comes in and they're like, my back hurts and it shoots down my leg. It hurts so bad. Nothing takes the pain away. It is so annoying. Just can you stop this pain? Very so often after obtaining an MRI, you can easily identify that there is a disc bulge, and a disc is kind of like a cushion between a stack of blocks in your spine that makes up your backbone itself. And when it moves out of place, the spine is really surrounded by a bunch of really important structures like the nerve. And when that disc bulge begins to push on the nerve, it could be a source of that annoying back pain shooting down the leg. So in cases like that, we can do a cortisone injection. And the goal of the cortisone injection is to really reduce the inflammatory response that the body has acted upon based on that injury. And by doing that, you can actually calm down the nerves and improve the symptoms and also mitigate the pain. Another thing that we do is facet injection. The facets are small joints in the lower back that actually have small spaces. Now, what I tell a lot of patients is anything that has a space in your back can really hide stuff. And when it hides inflammation and there's a nerve traveling around that space that it's hiding, it could be a source of pain. The facet joint is just another classic space in the lower back that can be really filled up with inflammation. So patients who have arthritis can have a lot of arthritis in that small joint, and that joint becomes a source of pain. Well, guess what? We can use an X-ray to find the joint, put medicine around it like steroid injection, or sometimes we can even apply heat. And the very common term for that procedure is called ablation. So I'm sure if you've heard your family members say ablation, that's really what they're talking about, where you find those little joints and apply heat. And what the heat does is eliminate the nerve coming from that joint. Now, another common procedure that we actually do, in addition to just the shots and the facet blocks or using heat to eliminate nerves that causes pain, is really minimally invasive procedures. So I tell patients there is a lot of options between injections and then getting cut open to get rods and screws. I'm not saying it's bad to have rods and screws, but there's so many options between that cutting open to get rods and screws and injections. And those things can vary from very minimally invasive procedures that can actually target specific nerves, modulate the nerves so your body no longer perceives pain. We call those procedures stimulators. There's so many other things we can do for spinal stenosis. Instead of having the bones peeled open and getting a big surgery, you can just scrape up a piece of the lower back that's causing the problem. And these are like almost no incision, and it's insane how much we can accomplish some of these therapies. So, in short, the things we offer can vary from injections, cortisone injections in the back, cortisone injections in the knee and the shoulders, to even performing more advanced procedures like applying heat. It's also called ablation around the nerves that are causing pain. That can be done in the knees as well, the lower back, the shoulder, and again, a lot of minimally invasive procedures that don't require like a big open spinal surgery.